Hello everyone, I'm Precious, and the T3 research area I focused on is nutrition messages in Zimbabwe. I chose a study that was based in Harare, Zimbabwe, that's titled Up Here, and the researchers wanted to showcase the effective use of communication skills to change behavior. In this particular population that was breastfeeding their babies. So this was a T3 research area because it wasn't done in a controlled clinical research setting. It was actually done in the participants' homes. They used a approved therapy, which was a lipid-based nutrient supplement, and it has been used in the past for undernutrition in Africa for babies. And the way that they disseminated information was through using communication and education. That was a very key part of the study. And they monitored changes in behavior and improvement in the baby's diet instead of focusing on new science discoveries. So, to give some background and clarity on some of the things that this study discusses, this was a example of trials of improved practices. That's a research technique that is formative, and I'll go into detail about that in the following slides. The focus of the study was to directly prevent certain behaviors and indirectly prevent undernutrition, but that wasn't the focus of the study. They were trying to improve practices in the parents of this study. So the complementary feeding that's discussed is referring to the introduction of solids to breastfed babies. And lipid-based nutrient supplements are something that has been used in Ghana and in Malawi. And the type of supplement that they use is called NutriButter, which is a ready-to-eat supplement. The objectives of this study was to improve underlying diet practices for babies. So these are mothers that are breastfeeding babies ages 6 to 12 months, and they want to start introducing solids to these babies' diets, and they want to do so in a way that will optimize the health of these babies in terms of the nutrients that they're being introduced to. So I mentioned before it was an example of trials of improved practices, and they actually looked at the changes in some of the nutrient consumption over 12 days per round. And the first round was using locally available produce and implementing that into such things as porridge and different things like that. And the NutriButter was actually used in the second round. And they used 32 babies in this study. And the trials of improved practices themes that they focused on were transformational learning, maternal values, resources, and cultural values and practices. So they concluded that the energy increased in both groups, as well as the nutrient and vitamin intake of these babies. And the transformational nutrition education was successfully implemented in a culturally relevant way. And there were extra types of vitamins and nutrients that were in the NutriButter supplement. So the babies in that group that used that also had an increase in that. But the focus of this was just to see if the behavior can change and to improve diet practices in general. So, in terms of what made this effectiveness research, this study did not use a placebo. They tried to evaluate the clinically effectiveness and risks of two therapies, which in this study was the non-NutriButter enhanced diet and the NutriButter enhanced diet. and they looked at the risks, benefits, costs, and those types of factors in Harare, Zimbabwe, by focusing on the things that were relevant to this group. So they used locally available produce, and they taught the women how to process the food, because some of the concerns was that the babies couldn't handle the supplements, because obviously they're babies, they don't have teeth yet, they don't know how to chew, and different concerns like that. So they focused on giving suggestions for those types of concerns, and as well as evaluating the hygiene practices and making suggestions in that area as well. And they used not only the medical providers that were a part of the research team, but they also used community nutritionists and village healthcare workers. And the participants later became uh, education participants, if you will, because they also spoke to mothers that were not a part of the study to give some suggestions that they learned through the study. So I thought that was a nice way to show that transformational learning was really happening. So it was a multidisciplinary team. The main team was in Cornell University, and the team in Zimbabwe was from the nutrition unit of the Ministry of Health, and they used village health workers as well as nutritionists in Harare, Zimbabwe. Johns Hopkins University in Maryland was also part of the research team. This aligns with my research interests by showcasing the different ways nutrition can be used. It's used in a preventative way, and preventative in terms of preventing diseases like undernutrition, which is a problem all over the world, but also preventing some behaviors that simple changes in these behaviors can improve some outcomes of the sample that is of interest. And communication that was culturally relevant was showcased in the study, which I thought was really important. It wasn't attempting to just observe something and give unrealistic suggestions. They wanted to really use the things that were available in the community in case, something like NutriButter, which is available, but if NutriButter isn't available, they were able to show that the locally available produce could improve some of the nutrient and vitamin and energy intake issues that were highlighted. And transformative learning is something that is showcasing the way that this was also a culturally competent and relevant study, because they didn't try and just teach something and make them adopt it, which is more so an assimilation type of technique. They wanted to learn what the community was currently doing and just give some suggestions and address their concerns. So that was the reason why that aligns with my research interests, and these are my references. And thank you.
Hey, Precious. I liked your presentation. It was pretty cool to hear how, like, I especially at the end when you were talking about how you felt like it was more transformative because they were helping people like adapt a new way of helping with nutrition by NutriButter, which is a very interesting concept. I think that's sounds pretty cool. Um, So, yeah, I thought this was and I like how they compared to other similar areas as well, of just understanding, of, like, how other populations could be affected or, like, even knowing mechanisms, that within their own community that could also be a replacement for that as well if they don't have access to the NutriButter. So I thought, yeah, it was just a very interesting study to see what kind of mechanisms they're doing to help get the nutrition to people that need it, and also doing it in a way that's more manageable and helpful to the area. and the community around them. So I thought it was very, very cool. Thanks.
Hi, Precious. I thought this was very well done. I really appreciate your graphics in all of your presentations. And I agree that this was a great example of a T3 research study where they were, like you said, not necessarily comparing or trying to see the effectiveness of this particular intervention only, but rather looking at how they can actually disseminate and the information and implement it into a community, and using that community participation to their advantage within the research. I'm curious if they had any members of the research of the community part of the research team when even developing the study, which is kind of a hallmark of patient-oriented research and participatory research. But it sounds that they did get these community members ultimately to sort of pay it forward and help them in the continued implementation of the use of this supplement. So thank you again for a great presentation, and it was spot on in terms of a T3 example, but yet different than your colleagues that I've reviewed already. So thank you again.